Right, okay, I think we'll make a start. So, morning everyone, welcome to this Joint Strategic Needs Assessment webinar on Best Start. So by way of introduction, my name is Will Leather. I'm a Public Health and Commissioning Manager at Nottinghamshire County Council. And joining me today, we've got Suzette Leach and Kate Whittaker, both of whom are Public Health Commissioning Managers at the County Council. And we've also got Sally Penn, who's a Family Hub Service Manager at the County Council as well. So the purpose of today is to summarise the findings of the Joint Strategic Needs Assessment, or JSNA, on Best Start, giving children the best start in life, and to provide an opportunity for you all to ask questions and share your own reflections, and then to think about how you can use the findings and recommendations to improve outcomes through your own work, through your team, or more broadly, through your organisation. So the rundown for today, I'll shortly hand over to Suzette, who will spend around about half an hour summarising the JSNA. During that time, please do use the chat to ask questions and share your own thoughts or reflections. We really welcome the different perspectives that you can all bring to this conversation. But please just do bear in mind that this isn't the place to discuss individual cases or confidential information. And in the second half of the session today, Suzette, Kate, and Sally will be responding to your comments and questions. So just a couple of bits of housekeeping. So the webinar is being recorded and it will be published online. And that's so it can act as a resource that anyone can access as part of the JSNA. And for that reason, for the first part of the session, cameras and microphones have been switched off. So just very quickly, for those of you who aren't familiar with the JSNA, the JSNA is about an assessment of current and future health and care needs of people in Nottinghamshire, and it summarises the evidence about what works to address those needs. We're constantly updating the JSNA, and this is one of many topics that we cover. So we've got the likes of mental health, carers, substance use, just to name a few of the really broad-ranging topics that we look at as part of the JSNA. So some of the benefits of the JSNA include that it highlights inequalities and the actions required to address them. It helps facilitate partnership working by combining different professional and community perspectives. It helps identify and share information about local community assets. And it enables commissioners, service managers, and other decision makers to identify priorities for action based on the balance of different needs. So the JSNA takes different forms, but it's all published online for anyone to access through a website called Nottinghamshire Insight. And just to be aware, the city and the county, there are different JSNAs. Sometimes we do produce work jointly, but on this occasion, although there'll be similarities, this is focused predominantly on the county. So without further ado, that's a quick summary and intro, but I'll hand over to you, Suzette.
Thanks, Will, and thank you all for joining us today. It's brilliant to see so many people on this webinar and from such a broad range of organisations. My name's Suzette Leach. I'm a Public Health and Commissioning Manager, and I'm going to present a summary of the findings of the JSNA. And then, as Will said, there's a bit of time at the end for Q&A session and discussion. The presentation will take about 30 minutes. And this JSNA profile pack explored the health and wellbeing needs of children from pregnancy to 2 years of age. It's an update of the JSNA chapter that was completed in 2019, and it's been used to inform the refresh of the Best Start strategy. A range of colleagues from across the wider Best Start partnership have contributed to the JSNA, including those in public health, local maternity and neonatal system, and family hubs. The JSNA explored a range of topics such as deprivation, smoking in pregnancy, teenage pregnancy, father inclusion, and parent and infant relationships. In the webinar today, we're hoping to cover why 0 to 2 years is important for supporting children's development, what are the health and wellbeing needs of children aged 0 to 2 in Nottinghamshire, and what can the health and care system and partners do to improve the health and wellbeing needs of children aged 0 to 2 years. Giving children the best start in life is a fundamental part of improving health and well-being and reducing inequalities. The earliest years of a child's life have a significant impact on their long-term development and their life chances. The early experiences starting in pregnancy shape a baby's brain development, and experiences during this time lay the foundations for lifelong emotional and physical health. There is widespread recognition that these early experiences inform outcomes in later life. Pregnancy and the early years also provides a good opportunity to engage with mothers, fathers, and caregivers who are motivated to make changes to support the health and well-being needs of their baby. A baby's brain doubles in size within the first year of life, and more than 1 million new neural connections are formed every second in the first few years. This short animation, developed by the Centre for Childhood, explains this really well. It outlines why early childhood matters, the rapid development that occurs, and how this shapes the adults we become. It's just a short video, so I'll just click play now for us all. I think the animation provides a nice reminder of the huge amount of development that happens in the first few years, and how a baby's early experiences shape their brain architecture and provides the foundation for all future learning, behaviour and health. As well as a range of professionals contributing to the JSNA, it was also important to gather parent voice. This diagram is a lovely summary of the feedback parents gave at the Baby Week celebration in 2023. We also ran further consultations at the end of last year and reviewed consultations completed by other services. Parents and carers were positive about local services and support, and highlighted the strength of service provision in Nottinghamshire. They identified green spaces and local amenities as some of the best things about local areas. They told us they were keen to hear about services and support as early as possible, especially during pregnancy, because they don't want to miss out or have to do their own extensive research. Breastfeeding and infant feeding support was a consistent area that families feel they would like more support with, and they feel services should involve dads more, provide opportunities for peer support and support with applying for nursery. We also ran a father and fathers-to-be survey because we wanted to hear directly from dads. They told us they would like more information specific for fathers on how to support and care for their baby, how to support their partners, and becoming a dad. They would like professionals to be more aware of the role of fathers and to include them in services, support, and conversations. As part of the consultation activity, we also asked mothers, fathers, and carers to pick priority areas from the 2020 Best Start strategy, helping us to focus the next stage of the work. They highlighted 5 important areas: the mental health of parents, being prepared for parenthood, positive pregnancy outcomes, good early relationships, and home learning. So now you shall hopefully see a poll appear on your screen any moment now. And there's a few short questions in there just to find out a bit more about the health needs of 0 to 2-year-olds in Nottinghamshire. There's 6 questions, and I'll give you all a few minutes to complete that before we move on to some of the answers. Okay, so it looks like most people have had an opportunity to complete that now. There's no prizes, I'm afraid, but I will quickly run through the answers to the quiz, and some of it we'll explore in a bit more detail as well. So, question 1, the answer to this is B, 7,466 babies were born in 2023. The rate is decreasing in line with England. Most babies were born in Ashfield, followed by Bassetlaw and then Gedling. Question 2, how many women attended a booking appointment by 10 weeks? The answer is C, 69.8%, which is significantly better than England at 63.5%. Why is this important? It enables early identification of potential risks, access to screening programs, and ensures that care is planned according to needs. It enables information to be shared about factors that might affect the pregnancy, such as stopping smoking, avoiding alcohol, taking supplements, and eating healthily. Question 3. An evidence review by the Father Institute in 2022 showed that father support to mothers had a positive impact on all three of these. And in some direct research they did, 80% of pregnant and new mothers said their partner was their primary support. The Father Institute also found that during pregnancy, birth, and the first 2 years of babies' lives, most fathers are present. 2/3 of fathers attend routine antenatal appointments, and more than 9 in 10 are at scans and the birth. 85% of parent couples are married or cohabiting when their baby is born. 5% of births are registered to two parents. In almost all cases, a mother and father, with 0.1% registered to two mothers. Evidence shows that a father's positive involvement plays a key role in improving child development outcomes. They have a positive impact on health, social, educational achievement, and future opportunities. Question 4, what percentage of women smoked at time of delivery? The answer to this is C, 11.8%. This is significantly worse than the England average at 7.4%, but the local trend is decreasing over time. I'll cover a bit more about this a bit later on in the presentation. Question 5, the answer to this one is A, 46.9% were breastfed at 6 to 8 weeks. This is worse than England at 52.7%, but the trend is increasing. And again, we'll look at this a bit more later on in the presentation. And the final question, BASQ3 is used to assess development at 2 to 2.5 years of age. It assesses 5 domains: communication, gross motor skills, fine motor skills, problem solving, and personal social skills. 79.6% of children achieve the expected level in all 5 domains. So the answer is A. This is similar to England at 80.4%, but the trend is worsening over time. And again, a bit more about that at the end of the presentation. These next 2 slides will cover some of the health inequalities that exist for 0 to 2-year-olds. Based on the 2019 Income Deprivation Affecting Children Index, Nottinghamshire is among the top 30% least deprived local authorities in England. But data comparing lower tier local authorities shows that the districts of Ashfield and Mansfield are ranked in the top 20% most deprived areas. Local data shows that of women booking a 1-year period, 43% of those living in Mansfield and 31% of those living in Ashfield lived in the 20% most deprived areas of England. The 2024 Membrace UK report highlights worse outcomes in pregnancy for women from Black, Asian and mixed ethnic groups. Women from Black ethnic backgrounds are almost 3 times more likely to die, and women from Asian ethnic backgrounds are almost white women. From 2022 to 23, the percentage of deliveries to women from ethnic minority groups increased to 8.6 in Nottinghamshire. Women are more likely to have mental health issues during pregnancy than at other times in their lives, including those who have never had mental health problems before. Low mood, anxiety, and depression are common. Nationally, up to 1 in 5 women have mental health problems during pregnancy or in their first year after childbirth. Local data from March 25, which reviewed women who were pregnant or had had a baby in the last 9 months, gave a slightly different picture, indicating 27.1% had a recorded mental health condition, which is 1 in 4 women. Fathers can also develop mental health problems around this time. Studies have shown a link between pregnancy and childbirth and increased depressive and anxiety symptoms in fathers. As many as 1 in 10 fathers are thought to experience postnatal depression. In teenage pregnancy, for teenage mothers, there's a higher risk of poor educational attainment, social isolation, and poorer mental and physical health. Teenage fathers can be invisible to services and are more likely to have pre-existing serious anxiety and depression. And their children are more likely to be born preterm or with low birth weight and less likely to be breastfed. In 2021, Nottinghamshire's rate of conceptions for females under 18 years of age was 15.1 per thousand population, which is similar to England's rate of 13.1. But there is wide variation across the districts, with Mansfield and Ashfield having the 2 highest rates of 26.1 and 21.7 respectively. Rushcliffe had the lowest rate at 5.7. This chart shows the percentage of women recorded as experiencing complex social factors in pregnancy. This could include domestic abuse, substance use, or those under 20 years of age. It compares England, Nottinghamshire, and the districts. Between December 23 to November, percent of pregnant women were recorded as experiencing complex social factors at the time of booking, which compares to England's rate of 12%. Again, as the chart shows, there is wide variation at district level, with Mansfield, Ashfield, and Bassetlaw having the highest percentages. So now we'll look a little bit at health and well-being. Being overweight or obese during pregnancy increases the risk of complications for a woman and baby, such as gestational diabetes, high blood pressure, and preeclampsia. The higher a woman's BMI, the greater the risk. Obesity is defined as having a BMI of 30 or above during pregnancy. Local trusts record the percentage of pregnant women with a BMI higher than 30 at 15 weeks gestation. Across Nottinghamshire, 26 to 33% of pregnant women had a BMI higher than 30. Low birth weight is associated with an increased risk of infant mortality, developmental problems in childhood, and poorer health in later life. It's related to factors in pregnancy such as smoking, substance or alcohol use, or poor nutrition. In 2022, 2.4% of term babies were born in Nottinghamshire had a low birth weight, which is significantly better than England at 2.9. Infant mortality is a measure of infant deaths under 1 year of age per 1,000 live births over a 3-year period. It is considered an important indicator of the general health of an entire population due to links with economic, social, and environmental conditions. But it's also considered to reflect the health and care of mother and newborn. The rate in 21 to 23 was 4.1, the same as England. Excuse me. Screening tests are used to identify women and babies at higher risk of specific health conditions or infectious diseases. Identifying this risk enables women to access specialist care earlier and make informed decisions about their health. Data for 23 to 24 shows that antenatal and newborn screening programmes in Nottinghamshire were performing within acceptable thresholds. And for vaccines to be most effective, high coverage rates are needed, so a decrease represents a risk to the health of babies. In 23 to 24, Nottinghamshire's level of coverage for vaccines administered between 0 to 2 years were all between 90 to 95%. And this is generally lower than the coverage level in 2020 to 21. These charts relate to smoking in pregnancy. Smoking can increase the risk of complications such as stillbirth, preterm birth, miscarriage, low birth weight, and sudden infant death syndrome. Children who live in a household where at least one person smokes are more likely to develop asthma, chest infections, meningitis, ear infections, and coughs and cold. The blue chart on the left for me shows the percentage of women smoking at the time of booking. It shows a comparison of England, Nottinghamshire, and the districts. In Nottinghamshire, 17.2% of women smoked at the time of booking, but most districts had a rate higher than this. Gedling was the highest with 21.4% of women smoking, and Bassetlaw the lowest at 10.2%. The bottom chart with the green and blue compares the percentage of women smoking at the booking appointment to those smoking at the time of delivery within each local hospital trust. It shows the impact the support to women during pregnancy has on reducing the smoking rates at time of delivery. As the quiz highlighted, in 2023 to 24, 11.8% of women in Nottinghamshire smoked at the time of delivery. These next two charts focus on breastfeeding. Breastfeeding provides health benefits to both mother and baby, and national guidance recommends exclusive breastfeeding for the first 6 months. In 23 to 24, 66.7% of babies had their first feed as breast milk, shown in the chart in the blue chart. This is lower than England, but the overall rate for Nottinghamshire is increasing over time. And again, as the chart shows, there is variation across districts. Rushcliffe had the highest rate at 79.6% and Ashfield the lowest at 58.9%. But many of the districts are showing the increase over time and some a large change. The green chart shows the number of babies totally or partially breastfed at 6 to 8 weeks of age. As we found out in the quiz, 46.9% of babies were breastfed at 6 to 8 weeks, which is lower than England at 52.7%. Similar to the breastfeeding initiation data, the picture across districts varies. Rushcliffe again has the highest rate at 63.2% and Bassetlaw the lowest at 36.8%. But all districts are showing an increase over time, and the partial data for 2024 to 25 seems to reinforce that pattern. As we already found out, 79.6% of children in Nottinghamshire achieved the expected level of development at 2 to 2.5 years of age, which is similar to England at 80.4%, but the trend is worsening over time. The primary areas of need are communication, with 13.8% of children not achieving the expected level of development, followed by gross motor skills and personal social skills. As this chart shows, again, the variation across the districts, Mansfield having the lowest percentage at 76.9%, followed by Ashfield at 77.2%. The overall trend in all districts except Rushcliffe has been a decline in the past 5 years. But now we've had a look at some of the findings, I want to share the recommendations of the JSNA. They're themed against the topics of preconception, reach, strategic approach, health inequalities, and data. Although preconception was outside the scope of the JSNA, the evidence base clearly shows a need to begin thinking about how to address some of these health inequalities before pregnancy. Reach focuses on early access to services, early in pregnancy, and also accessing services before challenges or difficulties arise. It also focuses on building on local and national campaigns to reach more people and removing barriers to information. Includes a focus on fathers and ensuring that resources, information and communication meet their needs. Strategic approach. The JSNA was completed to inform the refresh of the Best Start strategy. The work of the strategy will help to drive forward these recommendations. Priority areas for the strategy should include parental mental health, parent-infant relationships, children's early development, including speech, language and communication, and supporting parents as their child's first educator. Health inequalities, to highlight just a couple of those. Healthy weight in pregnancy pathways need to be further developed to support access to services, and we need to drive forward the infant feeding framework for action. And to reduce the rates of smoking in pregnancy, national and local initiatives should continue. And finally, data. The data analysis work to gather information for the JSNA highlighted challenges with some of the data available both locally and nationally, particularly in relation to the quality of data reported. Improving this would help to ensure that there is a good understanding of the needs of the community, and this could be best achieved through the development of a Best Start data dashboard. So that brings us to the end of the presentation part. Thank you all for listening. Kate, Sally and I are happy to answer any questions or hear any reflections that you might have about the information shared. So I'll hand back to Will now.
Thanks, Suzette, for that really helpful summary of the JSNA. If anyone is interested in learning more, there is what I'll do is I'll add the link in the chat to the full version of the JSNA, which has a lot more detail in there that you can look into. But for now, really, it's over to everyone in the room. Any questions or comments, reflections from what you've heard, your experiences based in your own work? Really, this is an opportunity to have a conversation and reflect on best practice or issues that there are across the county. So please use the chat. I'll also allow you to unmute your microphone now. But whilst any questions come in, Sally, Kate, any kind of initial thoughts, reflections that you want to add in at this point?
I think from Family Hub's perspective, we'd just like to acknowledge, sort of the challenges that we have in terms of that early engagement of parents in the antenatal period. It's one of our priorities for our service, and there's a lot of work going on in the background, both with commissioners and midwifery managers, and with our own sort of marketing and publicity to try and get parents to be able to self-serve. We're really keen that, as Suzette said in the first instance, that we engage families prior to there being an issue where that relationship building can happen, and families a bit more open to sharing their worries and their concerns. And we do actually have an offer antenatally, so we're keen that we make the most of that and that families get that support at the earliest point. I think a lot of the things that Suzette has referred to are Family Hub priorities, and there are services that support all of those issues, both within our own offer and within our partnership.
And shall I just jump in there as well, just to say that in terms of maternity work, there is a new group which is just being developed at the moment, which is the Perinatal Health Inequalities Group. Some people will know about that and will be being linked into that. But that's a system-wide group which is really just beginning to define some priorities, and evidently we'll be looking at all the evidence that's come out of the JSNA, also looking at the Best Start strategy, which is being refreshed in Nottinghamshire, and linking in with that. So there's lots of work that's happening there. I think some of the things that Suzette mentioned, such as weight management and weight management in pregnancy, there is lots of work going on already and pathways in place. So there is Your Health Knots, which is already linking in with the trusts to identify people. But I think as we dig into that a little bit more, we're all aware of the fact that, around 30% of people now are identified with a higher BMI in pregnancy, the risks that come with that. And we're certainly not seeing that amount of people beginning to take up services for all sorts of reasons. But I think we're really wanting to focus on that real positive offer that organisations such as Your Health Knots have, in not doing that kind of emphasis on obesity, but really talking about healthy pregnancy, engaging people in some of those services. So I think this new group that I've just mentioned will be picking up on lots of the great work that's already happening out there, and really just kind of trying to enhance some of those key areas.
Thanks both. So no one's coming in the chat, no one's being brave and asking any questions or comments. Okay, go on, kick us off.
Sorry, feeling brave. Can you even see me? Let's see if I can make you see me. Yeah,
I can see.
I work in public health on smoking and tobacco control. I'm really interested in the priority about preconception, because actually I think that's probably an opportunity for us to promote the offer for the Stop Smoking services, and also to transmit some messages to prospective parents about smoking, about secondhand smoke and smoke exposure, and stuff about smoking in cars. I'm just wondering how I can link in with somebody and start to talk about how we could maximise the synergy in this work, really, on that.
Shall I jump in there again, Suzette?
Absolutely, thank you.
So there's some early discussion starting on this, Kay. Obviously, it's a huge area potentially. So again, there's discussion around that group that I've just mentioned in terms of linking it in there. There's things that can be done, I think, that have been agreed that a good place to focus would be between pregnancies. So when people are pregnant, having a baby, it's a good time to be able to sort of talk to people as well about generally having a healthy pregnancy and what some of the key components of that are, because a lot of those people obviously will go on to have another pregnancy. Working more closely with sexual health, and again, I think some initial conversations have started around that. But yeah, I think it's early days. Keep linked in with us, with myself and my team, because we're sort of beginning to take forward some of those discussions and make those linkages. So yeah, it'd be really great to have you involved in that.
Great. Diane, do you want to come in with your question or comment?
Yeah, thanks, Will. It's just really a comment. Hi, Kay. Hi, everybody. I've just popped in the chat on Not Help Yourself, thinking about family self-serving and also professionals. We've got a couple of areas already that we've worked with various colleagues around pre-birth, getting ready for thinking about being pregnant. So I've put those in there, and we do have a section on smoking, Kay. So it'd be really great if we could work with you just to review that and add anything new in that you might want in there. There is something, but I think it's always good to have another pair of eyes on it and refresh and update.
Yeah, that'd be great, Diane. Happy to have a look.
Thanks, Kay. That'd be lovely. Thank you.
So we just had a go on to that.
I was just going to say it might be a good point to share the Best Start in Life offer as well, because that contains some of the antenatal information. If I can work out how to share it again. This is a, wait, let me share it with her. This is a tool that kind of parents can access that's on Not Help Yourself. I'll drop a link into the chat so that people can have a look at it on there in a moment. But it contains a whole range of information across the antenatal period, who the services are that families can expect to engage with, support for fathers, those antenatal contacts they can expect to be part of, the type of information they can get, where to get support for their health and well-being as well. So there's lots of information in there within that Best Start for Life offer. It starts from the antenatal period but goes all the way up to 2 years, and families can access it really easily through the Not Help Yourself page. It comes in a PDF, so it can just be viewed on that website. Professionals can print it out for people as well. There's a link to it in the Red Book. So once baby's born and the families are issued the Red Book, there's a link in there that families can use the QR code to view it. And at birth registration appointments, families are given a small QR code to enable them again to be encouraged to access that resource and that information. So yeah, so hopefully people will have seen that across the system a bit, but if not, I'd really encourage people to have a little look at that and share it with families as much as possible.
Great, thanks, Suzette. We've had a couple of questions coming in the chat. I'm going to start with Sarah's because it relates to the discussion we had around smoking. And I don't know if Kate or Kay, you want to come in. So the question is vaping being classed as smoking?
I know Kay's doing lots on that, so whether you wanted to have a word there,
Do you want me
Kay?
to try and answer that question? I mean, vaping is not the same as smoking. And actually, the public health goal with vaping is to try and position it as a tool for smokers to give up smoking. So we would, when we do messaging about vaping, we need to be quite careful that although no non-smoker should start to vape, we don't want to inadvertently discourage smokers from switching to vapes, because vaping is significantly less harmful than smoking. That is quite tricky. The NHS advice is that people shouldn't vape near babies or young children as a precaution, and that's what we say in our materials about this. So I don't know whether that helps to answer the question.
And I can just add there as well, Kay, that we've also had discussions in the Safer Sleep steering group around this as well, because the advice from the Lullaby Trust, similarly to co-sleeping if you are a smoker, is also that is an advisory really, because the evidence isn't there, that you should think about co-sleeping if you vape, because there may be risks that we're not aware of. But like you say, it's quite complex message, because we absolutely want people to be vaping rather than smoking if that helps them stop smoking during pregnancy. So like a lot of these messages are, it can be quite nuanced. I think Nat put her hand up at somewhere at that point.
Yes, I was just going to say that in maternity, we advise the same as Lullaby Trust to keep, if you vape, not to co-sleep, because that's what they're currently putting on their website. So, which is tricky, because it's having that nuanced conversation is really important, because you don't want to, you know, advise people to do stuff unsafely, but at the same time, parents do, if they're breast or chest feed, they will inadvertently bed share or plan to bed share, so we have to talk about it, so it's getting that balance. But yeah, Lullaby Trust does advise, if you're vaping, treat it the same as smoking.
Yeah, thanks for that, Nat. Yeah. Just whilst I'm speaking, I just noticed in the chat as well about vaccines. Will the perinatal health inequalities group be looking at maternal and childhood vaccines? I say it's early days with that group, just beginning to look at its priorities, but a lot of the discussion has been as well around some of the areas where there's already lots of work going on. So it might not be something that group needs to focus on. I think that group would need to be aware of, but not necessarily focused on as a priority. And there's a lot of work that's been happening around that within public health, in terms of doing lots of work with the public around that, lots of consultation. So our colleague Lucy Elliott, who lots of people will know, has been doing lots of work on that. So I think that group might be cited on that work, but won't necessarily be leading it.
Thanks, Kate. And just going backwards a little bit in the chat, we had a question, let me just find it, from Lisa, who was querying how local government reform will impact the strategy and how it might be delivered into the future. I think that's a question that applies to lots of different areas, and a question that's on lots of people's minds, and doesn't just relate to this topic. And I think it's a difficult one to answer. But does anyone on the panel want to give any thoughts at this stage? Or Lisa, do you want to come in first if you've got something to add to your question?
Hello. Yeah, it was really some of the challenges we've experienced at NUH is around different local authorities offering different services for the same thing. So weight management services not being offered by the same service. So depending on people's postcodes, we have to signpost this way or that way, and it can be quite confusing, and the offer can sometimes be very high in one and very low in another. So I suppose what I'm kind of looking for is, will local government reform look at smoothing out those kind of different types of services? You know, as a system, should we be offering the same weight management, the same smoking cessation? Should we be offering everything the same, even though different providers of maternity services are involved? And it's, I suppose I'm trying to kind of, it's a plea really, that we would really like it, you know, when we have two different red books and two different everything, it becomes, I think that impacts on whether people get referred, because people get confused who are working in the services. Do Slimming World still offer something? Have they gone out of business? Oh, I don't think there's a thing for the city anymore. And people start to kind of not realise what the current state of service is in order to make the referral, if that makes sense. So having clarity for people who don't work in local authority land but need to refer into local authority land would be amazing. And I think that's probably an old chestnut that's been around for a while, but I wondered if local government reform is the solution or is just going to add to the complexity, I suppose. So sorry, that's a long winding question, but it kind of gets to the heart of some of the challenges we've got as a system to get those referrals and that engagement up with across all of these different priorities.
Yeah, and I think as you described there, Lisa, it's something that's kind of known about, isn't it, across the system, all those challenges that come. What we've done with the strategy, because the city are about to launch their first Best Start strategy, this is the county's second reiteration really of the strategy, having had one for 5 years already. So we have worked closely with the city in terms of bringing them together and aligning the parts that we can, particularly around that maternity footprint, as we know that the hospital and NUH in particular is a key area for that. So we have done a lot of that work to try and align those pieces of work where we can. And then the group that sort of Kate described, this new perinatal group that's developing, that's going to be city county as well, coming together, and wherever we can, where those kind of challenges are the same and where the needs of communities are the same, because obviously it's two different communities as well. We're trying to align that work wherever we can and make sure that we're in touch with each other as commissioners and you know, the sort of public health people, to ensure that we are considering that as part of that planning of work.
Yeah, and again, I just want to second that, Lisa, and say that, you know, we need to, whatever the services are, we need to make sure that the pathways are as simple as possible, don't we? So basically, whoever's picking up, and if something does go to somebody in error as well, the wrong, that, you know, so it goes to county rather than city or vice versa, that, you know, action is being taken on that and people are getting to the right place. But yeah, absolutely appreciate some of the difficulties, you know, people working at NUH have had trying to separate out city and county people. You know, it's not easy to do. It just adds a complexity, doesn't it? So we need to be aware of that all the time and trying to make things as simple as possible.
Thank you.
I think Diane's been waiting to come in on that as well.
Yeah, I just wanted to add really that in order to hopefully make things a little bit clearer going forward, from next April, the city and the county are both going to be sharing the same digital platform. So whereas at the minute we've got Not Sat Myself and the city have got Ask Lion, the two platforms are coming together. We're just in the process of commissioning now a new provider, and there's lots of work going ahead to amalgamate what the offer will be going forward. So for people that are looking for services, whether that's a professional or a local member of the public, hopefully things should be a lot clearer, and you won't know whether you've got to have to go to Not Sat Yourself or to Ask Live, because it'll all be on one platform.
Thanks, Diane. That sounds really positive. Anyone else want to jump in with a comment or a question? If not, I've got one to carry on the conversation. So Suzette, I think this is for you first of all, but then interested to hear others' perspectives. This is obviously a refresh of a JSNA that had been done a number of years ago. What's your sense in terms of some of the progress that's been made since then? Are we seeing the same issues that are present now as to when the JSNA was last written? Have there been any kind of standout successes of things that have been achieved? Just, yeah, I think it'd be interesting to know how, you know, what's changed or what perhaps hasn't.
Yeah, so I think there's definitely more of a focus on kind of parent-infant relationship and the importance of that, and how we support the wider relationships across the network, be that professionals to families, across families, and for that parent and infant relationship. So it's definitely more focus on that. I think there has, as I sort of said within the presentation, around the ASQ 3 scoring, that has declined over these 5 years. So we need to understand more about that and what is happening with that, and how we support children around those key skills that they're developing. And then one of the brilliant achievements is around breastfeeding, and some of the increases that we're seeing around the breastfeeding rates, and the sort of work that's happening around that to improve those rates for children and the support that they're receiving. So that would be my very short summary of it.
Thanks, Suzette. And before I bring you in, Diane, Sally or Kate, do you want to make any reflections as well based on your perspectives of what's changed?
Well, I think it was pre-COVID, wasn't it, for starters? Yeah. And, you know, and we know the impact that that has had on families and young children. So one of the areas that I'm heavily involved in is around speech, language and communication. And there's been a huge demand on services since COVID, which has just been going up and up. So really sort of thinking about how we manage that and support children across a number of different services, really, but obviously including speech, language and communication, speech and language therapy services, who deliver something that people may know as home talk, but we're looking much more at that being a sort of early intervention offer that can operate in a number of different ways. And I know that lots of other services have been working closely with us on that, including how that links to family hubs and what's delivered through family hubs, services such as Home Start as well, the offer that libraries have. So really that kind of feeling that speech, language and communication is everybody's business. But yeah, that's where we've seen a massive impact, I think. Sorry, Sally, I think you were coming in as well.
Yeah, I'd echo exactly what Kate's just said. I think, you know, we actually took some feedback from parents as COVID lifted, and we did a welcome back discussion. So we got really good understanding around what their challenges had been, and that social isolation for families was hugely significant for both the child and the parent. I think also probably one of the successes within that period of time, because it was a very challenging time for all of us. As a service, we were commissioned before COVID, and as COVID hit, we were being paid in to be in the local authority and be a provider. So that was a really challenging time for the service, but actually a lot of opportunities came from that. So we were identifying where we got gaps in provision. We were identifying and really looking closely around the needs of our local communities, and developing and designing new services alongside parents to try and meet that need. So some of the things that you're seeing in terms of some of the challenges, you know, think about breastfeeding, whereas a lot of services closed down, which were children's centres. Within that period of time, our service in Nottinghamshire continued to flourish, and we developed things like Antenatal Babes, which is an online, in the main, not always, we can do it face to face, but in the main, it's an online provision which supports parents in their feeding choices. And it has a heavy focus on breastfeeding, but it's, you know, also supports parents who, you know, to think about what their choices are. And we found within that our online presence is increasing the engagements of fathers. So as fathers aren't always comfortable about walking into a service, if it's online, they're sat in a room and engaging as well. So our services have gone from strength to strength and are continuing to do that. You know, continually looking around where we need to re-strengthen. So we are aware about the ASQ scores. We now have a really sound offer of Baby Peep, Toddler Peep and Peep Little Sparkles. Peep Little Sparkles for those children who have emerging SEND. They may go on to the need more intensive support and may need specialist support, but a lot of these children just need a little bit extra. So our services really are quite fluid, and they're quite broad as well. So, you know, but very much partnership focused. I've popped the link into our Family Hub network to find out what our offer is, because as somebody mentioned, we are mindful that Nottinghamshire's still got quite a significant investment in family hubs compared to other local authorities. So, you know, our offer is quite huge in comparison to some, but we are working with City in terms of how people find it easier to navigate our services, so they don't end up in the wrong area, because we know we are a little bit of a postcode lottery. So for us, I think, you know, we have got a good handle on what the challenges are, and are keen that we address those in a partnership approach. That makes sense, Will?
Yeah, great. Thank you. Thank you all. Diane, do you want to come in at this point?
Yeah, I don't know whether Jill's on the call, but I just wanted to sort of flag up that one of the main things you mentioned, breastfeeding rates, and in that period, you know, we've gone from both Notts Healthcare Trust and also the Children's Centre service, now Family Hub service, both undertaking the UNICEF baby friendly gold initially, and then also doing their 4-year gold reaccreditation, and we've just recently within the Family Hub service in the county have just been reaccredited at gold, and last year the Healthy Family teams were as well. But one of the real changes has been that move to really valuing and working collaboratively as to how we best can support families to consider and sustain their breastfeeding journey. And I know Natalie at Sherwood Forest Hospitals, for example, the work that they've been doing at Sherwood Forest Hospitals linked to the UNICEF baby friendly standards as well is great and groundbreaking, you know, and things like the lime green team. That it really takes, it's a big juggernaut to change, but I think because of all of this work, system-wide work, I think we are seeing that improvement, and I think it's something to be, you know, celebrated and acknowledged that within the county. And more recently, we've started working much more closely with the city to look at a whole city county approach to infant feeding, which I think is, you know, bodes really well for the future.
Great, thanks, Diane. So we've had a comment in the chat from Sarah, who's reflecting on ASQ and filling out the forms as a mother, and some of the challenges that can have, and perhaps that some families will benefit from support. Does anyone on the panel want to reflect on that?
Yeah, I think that's really good feedback, really useful feedback, and certainly something that we can share. So Jill, yeah, our colleague who works closely with the Healthy Family teams, we can have a look at that and the reflection on that. We are also thinking at the moment about how speech, language and communication needs are identified at the 2 to 2.5 year review. And whether we need to do a bit more work on that with the Healthy Family teams as well. So I think that's really good feedback. It's about preparing people, isn't it, fully for what they can expect in relation to the ASQ, what that leads to, what they need to do. So yeah, so thanks for that, Sarah. I think that's really useful feedback.
Thanks, Kate. So we've got 3 minutes left. So I think we've got time for one more question or comment if anyone wants to jump in.
There's a comment that's come in from Lisa around continuity of care.
Yeah, yes, I was just going to it was in response to the information about infant feeding. I don't know if people are able to access that screenshot if they're outside of our organisation, but essentially we have fantastic data from our home birth team that provide antenatal and postnatal continuity. So our breastfeeding at first feed, day 3, day 5 and discharge were all kind of in the 90% or above category. So I think the work that we're going to do with continuity of care is going to be hopefully make a significant impact on infant feeding. We do have infant feeding leads in maternity, and we also have band 3 infant feeding support workers. So how we map our service across supporting families, I think is going to be really interesting. But I do think continuity of care is something that everybody should know about, because that does really make an impact on all of the ways that we can develop relationships antenatally in order to encourage people to take up what's available in their local area, the hubs, the Best Start, all of that is going to be fantastic. Natalie, I'll get back to you directly.
And again, just to say on that, Lisa, I know it's been within the equity strategy for the LMNS, hasn't it? And again, I think that equity strategy is being refreshed at the moment and being looked at. So again, whether it will or won't be brought into that perinatal health inequalities group, I think obviously it's still recognised that that's a real key part of work. And it may be that enough is being done on that at the moment for it not to have to be a priority for that group. But you're absolutely right that it's really key, isn't it?
Yeah, I think we can describe it as the kind of what we do upstream in maternity has the impact downstream. And I think someone put it to me that sort of I think it was the social prescribing team said that they were seeing a lot of babies at 6 weeks with nappy rash issues in the GP clinics. It's that kind of input earlier on about how to look after baby's skin, which might prevent them appearing in the GP practices later because they haven't got those issues. So I think there's a lot of interest and pressure on maternity doing those things, but we need the resources to do that and the mechanisms and system design to help us. But I think there's a planting seeds early. We see the benefit of it down in further services that we don't have anything to do with, but they see the benefit.
Fantastic. Thank you, Lisa. That's really interesting to get that perspective. But unfortunately, we run out of time. So I just want to say thank you, Suzette, for presenting, and thanks to Sally and Kate for being part of the panel and answering your questions. I think it's been a really interesting session with lots of good conversation and questions and comments. So thank you everyone for your time. I've just put in the chat a quick feedback form if you do have the time just to spend a minute giving us some feedback as to how you found the session, anything we can do to improve, that would be much appreciated. But for now, thank you everyone. I wish you a good rest of your day.